For 1 year of my life, I bought my own medication. For the past 4 years, my drugs have been funded through PepfarMiddle programs. Medicines for opportunistic infections are also coming from external donors, and from Civil Society Health Forum we conducted research in 4 districts of Zambia, and our findings were very similar. If you look at the health center budgets, the government contribution is normally zero. Everything else comes from external funding. So when most people started taking treatment, if you look at people who are taking treatment now, we started taking treatment on the understanding that we were promised medication would be given free of charge for life. But if the Global Fund is not funded, less money comes into PepfarMiddle. What does it mean? It means people have to start buying medication. Already we have very high unemployment levels, with only 15% of our population in formal employment. So those who have started taking medication cannot afford to buy the medication on their own. So we need to see more government commitment in terms of providing antiretroviral treatment for its people. We talk of scaling up people on treatment, but can we afford to sustain those people if external funding is not available?
There's a process, I understand, having represented people living with HIV on the NAC Council. There's a process of the AIDS Trust Fund. How quickly it can be set up and all that's still being left, it's still in the pipeline. Right. Where you have a levy on everything that is bought. You know, the situation was good in Zimbabwe, but unfortunately because of the political and then financial position. But maybe let's start thinking. There's the windfall tax that the mines are not paying. You know, we have to be creative.
We need to look at the bigger picture on how can we effectively sustain our economy in terms of finding money for healthcare. We can find the money in country. In country, we can find the money in country. And if we did start moving towards that direction, even external donors will be more willing to help. Right now, we're not sure if round 10 is going to go through. I hate to think about what is going to happen if it doesn't go through, because that has very huge repercussions for us as a country. We have put in systems in place to see that it does not happen again. The Ministry of Health is very, very willing to even talk to civil society to say, come through, look at what we have done, this is what has been done. So I think with round 10, if we did get round 10, I'm very certain the money is going to get down to the people, because people really need treatment.